Hi guys, welcome to Family Scope. Here in this channel, I'll discuss all that pertains to family health. My name is Juliet Hazu. I'm a nurse and also a public health educator. Welcome. We have a very important topic today. And what's that? Hypertension. Hypertension has become a very glorified name among among our environment, among our generation. That is because it has become a common disease condition among three adults. We have one person that is hypertensive. Isn't that alarming? It is actually a huge number. So, what are the causes of hypertension? What is hypertension? Hypertension can be defined as the way blood flows to the heart through the arteries, through the veins, the way the realms, as in the flow of blood to the heart. So, what are the causes of hypertension? What are the type of hypertension? Hypertension can be caused by our lifestyle. Perhaps you're on the fat side, you're obese. This can actually expose you to having hypertension. If you're that person that likes taking too much of salt, this can actually expose you to hypertension. If you drink a lot of alcohol, if you smoke a lot, if you stress yourself too much, you don't give yourself enough time to rest, enough time to sleep, this can actually expose you to hypertension. If you don't give yourself at least 8 hours of sleep, this can actually expose you to hypertension. And what are the type of hypertension? We have two basic type of hypertension. We have the essential hypertension or the non-essential hypertension, or it can actually be called primary hypertension or secondary hypertension. Primary hypertension is the hypertension that is etiological. That is to say that this hypertension does not have a cause. It can come as a result of family lineage. Perhaps your father is hypertensive or your mother is hypertensive. This can actually expose you to having hypertension because it runs in the family. So if your father or your mother is currently taking medication, hypertension medication, you need to be very careful of the kind of lifestyle, the kind of habit you will introduce yourself to. Is very important. You're careful so that you'll be able to go on, live your life without exposing yourself to this condition. Then the secondary cause of hypertension, secondary type of hypertension is that type that is caused by other systemic condition. Maybe you have a kidney disease, maybe a liver condition, maybe other systemic condition, other failures of the body organs can actually precipitate this other secondary type of hypertension. So, what are the signs and symptoms of hypertension? We have headache, we have dizziness, we have shortness of breath, we have um, increase in respiration, increase in respiration, we have nose bleeding, we have excessive, we have the person is sleeping, excessive sleep, we have the person is sleeping too much. This could be signs of hypertension. So how do you know? And a disclaimer here, hypertension does not actually, some people it does not present with any sign. That is why it's called the silent killer, because I'm sure you have heard or you have seen where somebody slumped, where somebody went to take their bath and now slumped. Maybe somebody slept and the person did not wake up. So it does not have any sign. You might have your BP might be reading 190 over 120 without any sign. You might not be feeling anything. No headache, no distress, no dizziness. You might just be your normal self and you go to the hospital and they said, God, your BP is high. So we need to be very careful because it is a silent killer. Because the next thing, it can cause cardiovascular accidents, which can lead to stroke and other systemic failures of the body. So we should be very careful because this is a silent killer. Hypertension is a silent killer and it is very common among our generation. That is why I advise, once you're up to the age 35 years and above, always check your BP. Is very important. From time to time, go to the hospital or you go to the pharmacy and check. If it happens that your BP is on a normal note, you need to be very careful. Live a healthy lifestyle. Don't expose yourself to taking too much of alcohol, smoking, to other drugs that might destabilize your system, because the way you treat your body right now will determine how long your body will carry you, how your body will treat you. how your body will take care of you. It's fun to be living in a good body. This our body is the only home we have, so we need to take it, treat it very nice, so that it will take us. We will live longer, healthier, and we will not be struggling with our health as the time goes by. So hypertension is a systemic condition that can actually affect other organs of the body. If you're hypertensive and you don't take your medication, you don't treat yourself, you don't follow the do's and the don'ts, you can actually traumatize other organs of your body. So it's very, very important that you follow. How do you prevent this condition? By sleeping well. Avoid stress. Take at least 8 hours of sleep daily. When it's night time, shut your phone off, or you put it on a silent tune, or on the flight mode. Sleep. Get 8 hours of sleep is very, very important for your body, your mental health. Sleep is very, very important. If you're prescribed, you're placed on certain medication, please take your drugs. Don't just stop your medication without informing your doctor. Inform your doctor before you stop any drugs that have been recommended for you. I've seen a lot of patients come to me and say, huh, nurse, I can't take this drug again. I'm having these issues. I've not been taking my BP drugs. Why? You might just have hypertensive crisis, and this is very dangerous because if you are experiencing any systemic side effect as a result of medication, because I observed that this is more common among the male folks, they experience some side effects that can be psychologically traumatize them. So if you experience such, please go to your doctor, tell the person, explain to your doctor, this is what I'm experiencing. There are other options that they can use, that can be given to you. They can change your drugs. So it's very, very important that we follow the regimen, because this condition can be treated, it can be controlled. I've seen people that have lived with this condition for 30 years, 40 years, they are still living. And I've also seen people that have this condition within 3 years, and they are no more, they've died. We've lost them. So it's very important. I've seen some of my patients will come and tell me that I was diagnosed of hypertension 20 years ago, 40 years ago, and here they are taking their drugs, living fine, looking healthy. Isn't that wonderful? Some people say that I don't want to be taking drugs every day. I don't want to be on drugs every day, my dear. Just look at it. For instance, me as a person, I take my supplements every day. I don't look at it as a problem. Every day I take one capsule, two capsule, and that's it. It doesn't change who I am. I just want to be healthy. I just want to be at my best self, give my body the best. That is what your aim should be, to give your body the very best so that you can live long, so that you can live healthy. So hypertension is a silent killer, so we should be very careful. Eat right, don't eat too much of salt. Exercise at least 3 times in a week. Avoid dangerous habits. Avoid taking of drugs that can destabilize your system, that can traumatize your whole body. So it might be fun, it might be interesting at the beginning, but it will lead you nowhere. It's gonna destroy you. So avoid taking of certain drugs that will traumatize your system. Limit the consumption of alcohol, avoid smoking, avoid whatever thing that is giving you a different whim. So we need to be very, very careful with our health. So guys, this is all I got for you. So if you are going to be taking, so there are some certain supplements you should be taking. Let me say omega H3, very, very important. Folic acid, very, 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 very important. CoQ10 is also very, very important. Then garlic capsule, or garlic, you can get the raw garlic, add it to your dishes, you can crush it, you can eat it directly. It's very, very good for your heart. So that is all I have for you guys. It's very, very important that we do the right thing so that we live longer, for our families that loves us, for ourselves. So that is all I have for you guys today. Bye. Follow my channel. I love you all.